Here at Q13, we're having an important conversation about mental health, and our goal in all of this is to end the stigma.
It is something we have talked about so much. We want to talk about it with you. And this morning, we're focused on teens and mental health. In fact, some really shocking new numbers about teen suicide rates in the U.S., they just continue to rise. The CDC actually says rates jumped 70% over a 10-year period among white teens and even higher among black teens, up 77% from 2006 to 2016.
Yeah, these are crazy numbers here. So we've got Dr. Elizabeth Meade joining us this morning to talk about recognizing
I'll rewrite it for her.
Okay. And also having those tough conversations as well. Doctor, good morning.
Good morning.
So, I mean, as we just showed folks, I mean, those are really alarming numbers. So what can we as adults do for teens who might be struggling with, thoughts of suicide or depression?
I think the most important thing as adults is just to recognize that. And if you know a teenager or you have a teenager in your home or you work in a school and you notice that someone is struggling in any way, that you really reach out to them. I think lots of teenagers that I see who have mental health issues say, if someone had just asked me about it, I probably would have talked about it, but I didn't want to bring it up.
What if I, as a parent, I'm the last person my teen wants to talk to? Like, should I ask other people to step in? How do I have sort of that conversation when a teenager doesn't want to talk to me?
And they may not. Teenagers do not want to talk to their parents about a lot of things.
Right.
It's really important to find some adult that they can talk to. So the most important thing is to find someone, a counselor, a therapist, that's a mental health professional that your child is comfortable with. And sometimes that takes a few tries. It has to be the right feeling and the right vibe between the provider and the patient. And so sometimes you need to shop around a little bit.
So you mentioned, talking about recognizing the warning signs, and you even mentioned not even just parents, but also maybe school administrators, school counselors. So when we talk about recognizing it, what are those signs that we need to watch for in teenagers?
Well, there are some groups of teenagers that are more at risk for suicidal thoughts or suicide attempts. And so those can include kids who have had mental health diagnoses already, so depression, anxiety, anything else. Kids who have been bullied or who have been bullies actually both have an increased risk of suicide. And then kids who have struggled with gender identity, sexual identity, anything else that is makes them feel different can be really challenging. So I think that if you know a kid who's at risk, it's great to just check in with them. But the important thing to also remember is that even without any of those risk factors, if you know a child who's becoming more withdrawn, who's stopping to do activities they really used to love to do, who's not spending time with friends outside of the house, those are all warning signs that there may be some issue that you need to delve into a little bit.
We just don't talk about mental health issues enough in this culture. I mean, that's why we're sitting here having this conversation, why all month and hopefully continuing on we're going to do this. So how could we set an example in our homes of breaking this stigma? I mean, should I be talking about mental health things over the dinner table?
Yeah, I think yes. I mean, I think we don't talk about it enough, and when we do talk about it, it's often in a really negative light, right? We don't often talk about regular functional people who are living with mental health diagnoses. So I think part of removing that stigma is to talk with your kids and with your teenagers about how common it is and ask them, maybe a good way to start is not, do you have any worries about this, but do you know anyone who might be struggling with that? And sometimes opening that door for a child to say, well, actually my friend seems really sad, can help dive into that conversation about their own feelings.
And I know parents always, of course, as parents, you want to have the answers for your kids. You want to be able to have that. But if you feel overwhelmed as a parent, I mean, when is it okay, to reach out to maybe some outside help?
It's always okay, and it's really encouraged. And I think that even if you do feel comfortable talking with your child about it, if you're worried that there's an issue, it's always recommended to seek professional help. The kids who do best, who really have significant depression, anxiety, or other diagnoses, usually do best with a combination of medication and therapy. So either one of those things can be helpful, but really they're most powerful together.
We only have a couple seconds left, but I really want to ask you, I mean, if I'm struggling with mental health issues or seeking mental health help or I'm on an antidepressant, is that something I should tell my kids about?
I think it depends on the age of the child. So younger kids probably not, but when you get into those teenage years, I think those are really important conversations to have, and they can help normalize it as well.
That's a really good point. Normalizing, I think, is part of ending that stigma.
That's exactly right,
Dr. Meade, thank you so much. We love having you here, and this is great information. And we always want to say, if you are struggling or if you are in crisis, you need someone to talk to, please reach out. National Suicide Lifeline, I mean, just jot this down, 800-273-8255, or you can always text the word HOME 24/7 to the crisis text line at 741-741.